Hey everyone, and welcome. When we talk about medications you put on your skin, the active drug is only half the story. The other half, the stuff you put it in, is just as important. Today, we're going to do a deep dive into one of the most elegant and honestly patient-friendly options out there, the pharmaceutical gel. Let's get right into what makes these so essential in the world of pharmacy.
So, imagine you're a pharmacist or a formulator. You have this fantastic active ingredient, but now you have to decide, what's the best way to deliver it? Should it be in an ointment, a cream, a gel? This isn't just a trivial choice. It can literally be the difference between a patient using their medicine as prescribed or just leaving it in the cabinet because it feels, well, gross.
And this really gets to the heart of it, right? It's all about the patient experience. In one corner, you've got your traditional ointments. We all know them. Greasy, sticky, they can feel warm, and they're a pain to wash off. But in the other corner, you have the gel. It's light, it's non-greasy, it washes right off with water, and you get that signature cooling feeling. It's this huge difference in feel that makes formulation science so incredibly important.
Okay, so here's our game plan for today. We're going to start with the big picture, the whole world of semi-solids. Then we'll introduce the main players, ointments, creams, and the like. After that, we'll zoom right in on gels, check out their different types and uses, and then wrap up with how we make sure they're actually safe and effective. Sound good? Let's go.
All right, let's kick things off with that big picture. Because to really get why gels are so cool, we first need to understand the family they belong to. And that family is the semi-solid dosage forms.
So what is a semi-solid really? Well, unlike a pill you swallow or a liquid you drink, these are made specifically to be used on the outside of your body, on your skin or on mucous membranes. And the goal is usually one of two things: either deliver the drug right where you put it for a local effect, or have that drug travel through the skin and into your bloodstream for a systemic body-wide effect.
So what's the dream? What makes a perfect semi-solid? Well, formulators are always chasing this ideal trifecta of properties. Physically, you want it to be smooth, not gritty or greasy. Physiologically, it absolutely cannot irritate the skin, and it should play nice with your skin's natural oils and sweat. And finally, from an application standpoint, it's got to be easy to put on, easy to wash off, and of course, it has to release the drug effectively. Nailing all three of these is the real gold standard.
Okay, foundation is set. Now let's meet the other key members of this semi-solid family. It's super helpful to know the whole lineup to see exactly where our gels fit in.
First up, we've got ointments. You can think of these as the heavy-duty protectors. They're often based on things like petroleum jelly, and their main gig is to form a seal, a barrier on the skin, or to really soften it up. They're fantastic at locking in moisture, but that greasy feeling, it's not always what people want.
Next are creams. Now, creams are emulsions, which is just a fancy way of saying they're a stable mixture of oil and water. This is what makes them feel lighter and makes them way easier to wash off than ointments. You generally see two types: oil and water, which you might know as vanishing creams, and water and oil, like your classic cold creams.
And then you have pastes. These are the thickest, stiffest ones of the group. What's really unique about them is they don't melt at body temperature, so they create this super durable protective layer. Think of it like a medicated shield for your skin.
So, what's the secret sauce that gives pastes that signature stiffness? It all comes down to this number. They are packed with solid particles. We're talking more than 50% of the entire formula. That super high solid content is really their defining feature.
Okay, so we've met the whole family, we know the landscape. Now let's put the spotlight right where it belongs, on the star of our show today, the pharmaceutical gel.
The classic definition actually calls them jellies. What really makes them stand out is that they're see-through, or at least translucent, and they're not greasy at all. They're made when these things called gelling agents, which can be natural, like a gum from a plant, or synthetic, like methylcellulose, form this amazing interlocking 3D web that traps liquid inside.
So this unique structure and feel makes gels unbelievably versatile. Let's take a look at the different ways we actually use them in medicine. You can basically put gels into two big buckets. On one side, you have medicated jellies. Their whole purpose is to deliver a drug, maybe a local anesthetic or an antiseptic. On the other side, you have lubricating jellies. Their job is purely physical, to reduce friction for things like catheters or surgical gloves. And because they have totally different jobs, their formulas are different too. So what is actually going on when you put a gel on your skin? It's a pretty neat little process. First, you apply it. Almost immediately, the water in the gel starts to evaporate.
That evaporation pulls heat away from your skin, and that's what creates that classic cooling sensation. And what's left behind? A super thin film that holds the active drug right where it needs to be to do its job.
So we've established that gels are effective, and people tend to like using them. But how do manufacturers guarantee that every single tube is consistent, safe, and does what it's supposed to? Well, it all comes down to some really strict quality control testing.
These tests are absolutely critical. It all starts with just looking at it. The appearance. Is the color right? Is it smooth? Then you measure viscosity, which is just its thickness to make sure it's consistent. Spreadability checks how easily it applies. Then, of course, a chemical test, or assay, confirms you have the exact right amount of the drug. And finally, and most importantly, safety tests are run to make sure it won't cause any skin irritation.
So, to wrap it all up, gels are just a fantastic option in our toolkit for topical delivery. Their non-greasy feel makes them incredibly patient-friendly, their structure makes them super versatile for different drugs, and they are just plain effective at getting medication right where it needs to go.
And that brings us to a final thought to leave you with. We've seen how great gels are now, but what about the future? As we create new, more complex drugs, I'm talking about huge molecules, biologics, maybe even gene therapies. The big question is, what's next? How is that next generation of advanced gels going to evolve to meet these new incredible challenges? It's a really exciting time in pharmaceutical science. Thanks so much for joining me today.